Welcome to Season 2 of Talk Me Healthy. Each month, we invite a guest to explore a topic related to healthy living. They share their expertise, personal stories, and we learn from them how they turned their passion and knowledge into practical tips that you can use now to improve your health. I'm your host, Sherry Keating, founder of Diabetes Care Consulting. My goal is that you will hear something each show that will motivate you to make a small change towards living a healthier, happier life. Hello and welcome to Talk Me Healthy. My name is Sherry Keating, your host, and today we are actually on location at the Mass Match Assistive Technology Center in Worcester, which is operated by Easterseals. I want to introduce my guest today. We have Bilotta, who is the program coordinator for the Assistive Technology Regional Center, and we have Alexandra Ullrich, and she's the program manager of Transition and Employment Services, and Adam Costello, who's the Veterans Program Coordinator. So first of all, thank you so much for letting us come into your center and shooting on location so that we can actually show the viewers all the awesome technology that you have for people with disabilities and to learn more about Easterseals.
Well, thank you for coming down.
Oh, you're welcome. This is great. So Allie, I wonder if you could share a little bit about Easterseals and what the mission is and some of the program and services offered.
Yeah, of course. So our mission here at Easterseals is to provide equal opportunities for youth and adults with disabilities to live, learn, work, and play. We do that through a variety of programs and services, which I'll just briefly touch on now, but you can definitely find out more information about all of these programs and services on our website. Our first program, as we're in the Assistive Technology Regional Center, is our Assistive Technology program. That includes 2 different Assistive Technology Regional Centers, alternative augmentative communication devices, and AT loan programs. We also have rehabilitation services, which are out in the community in a variety of different ways, doing physical therapy, occupational therapy, speech therapy, and applied behavior analysis. Our youth services programs include our Youth Leadership Network, which is a monthly group. We have mentorship opportunities for youth with disabilities. We have 2 different recreational programs. That's our Adaptive Martial Arts and our Adaptive Swim program. We also have our Military and Veteran Services programs, which Adam will talk more about in a little bit. And finally, the programs I oversee are our employment and transition programs. So our employment programs do a variety of things. We have a pre-employment program where we help youth get internships for the first time to introduce them to the world of work. We do soft skills training, we do on-the-job coaching, and we really give youth an opportunity to get into the competitive workforce for the first time through internships, which sometimes eventually even become jobs. We also partner with the Massachusetts Rehabilitation Commission and private clients to help adults with disabilities find and maintain employment through a variety of ways, including helping them with resumes, interview skills, we help them job search, we help connect them with employers that we have employer partners with, and then finally our transition services. We do transition assessments for high school students to help the school determine the best way to help the students transition from high school into adult life, whether that be college, independent living, or work. And we also have a brand new program, which is really exciting, our college navigation program. As many of you know, there are a lot of accommodations that are available to students in high school on their IEP. And oftentimes there's a large gap between what's provided in high school and what's provided in college. So we've created a new college navigation program to help students adjust to their life in college, to help them talk about and get accommodations, to help them with time management, organizational skills, social skills, and really just help them adjust to college life so that they can successfully graduate college and go on to be employed in the workforce.
So Allie, do you know how long Easterseals has been around? I mean, I know of Easterseals, but I didn't realize all the things that Easterseals actually provides for people.
Yeah, So Easterseals National has been around for almost 100 years, and we are about to actually celebrate our 75th anniversary here in Massachusetts.
That's wonderful.
Yes.
So is it geared towards people with disabilities? Or, because what I'm hearing from you is it also helps kids in college and in schools, but are those kids with disabilities or?
They are. So our whole mission is to help people with disabilities to live, learn, work, and play. We have most recently added on the Veterans Service Program, so that those people don't necessarily have disabilities, but the rest of our programs are geared towards people with disabilities. With the exception of our Assistive Technology Regional Center, while it's geared towards people with disabilities, anyone can come to our Assistive Technology Regional Center regardless of disability and borrow different technology. But our programs are geared towards empowering people with disabilities.
And is this the only location of Easterseals in Massachusetts?
So this is our main headquarters here in Worcester. We have a satellite office right in downtown Boston by South Station. And our staff are all over the state. So we're a very itinerant organization. So that we have people all over. We are in schools, we're in people's homes, we're in rehabilitation facilities, colleges. We're really wherever the clients need us to be. We believe in not so much institutions, but we believe in supporting people to be as much a part of their community as possible.
That's wonderful. And one last question, how do we access Easterseals to enroll someone in any of these programs or for someone to get more information?
So I would say visit our website is the best way. Through our website, you can find the specific contact information for each program. Some programs are completely free and don't have eligibility requirements. Other programs do have eligibility requirements. Some of them are state funded. It really depends on the program. But I would say the best way is just to go to our website. We have our phone numbers on there, our emails, all of our contact information.
And that website is?
www.eastersealsma.org.
Eastersealsma.org. Wonderful. Well, thank you so much.
Thank you.
Adam, so you're responsible for the Veterans Program.
Yes.
Would you mind sharing some information?
No, absolutely not. As Allie said, we don't work with just veterans with disabilities at Easterseals. We work with all veterans.
Okay.
And the reason for that, if we go back into Easterseals history in World War II, right?
Okay.
So Easterseals prior to that was an organization that worked with children with disabilities, but there weren't adult services available. After World War II, we found there was a great need in the community for rehabilitation and assistive technology and to provide services to the adult population. And so that became a big focus of Easterseals. As time went on, the services for the disabled population continued to grow and grow and grow, and there was a demand for that, and time changed. And now we're finding that the demand for veteran services has increased to the point where we're getting back into that specifically. So with myself, I was a medic in the Army. I got out 6 years ago. I've had multiple deployments to Iraq. I have a lot of experience in the military community. When I came home, I found that there was a variety of programs that were there that were able to respond to somebody in a crisis, right? But there weren't many programs that were there to help prevent these crises from happening. Right? So there wasn't a lot of early intervention, even if all the warning signs were there. So that became a focus of ours here. We're a 5-month-old program, right, as part of Easterseals, right? So we're still brand new. So we started looking at this head on. We started looking at what exists out there right now. So I'll use veteran suicide as an example. We can talk to a lot of different examples, but veteran suicide is a subject that's in the news quite a bit, right? And the popular number out there is 22 per day. 22 veterans per day commit suicide. Wow. Statistically, the actual number, if you go by the data that's out there, is 20.6 per day, right? So.
Regardless, that's too many.
It's one's too many.
One's too many, absolutely.
But when we're talking to this rate, I mean, this is definitely a crisis.
Absolutely.
Right? And so the response to that has been creating expanded mental health benefits, a veterans crisis line that you can call if you're having suicidal thoughts. You're to that point, and all of those are reasonable reactions. But what have we seen over between 2005 and 2015? We've seen continue upward increase, right? So that's too late to begin to intervene. When that person hits those suicidal tendencies and those suicidal thoughts, yeah, you definitely need resources to jump in. But what we want to do is definitely create that community and that feeling of belonging right here, right now. And I can tell you from my own transition that when I came home, I felt very alone. There was nobody in the community that I was aware of at the time who went through similar circumstances, transitioning from military service to civilian service. So it can be a lonely time. The resources that exist, whether it's on the federal or state or local level, a lot of people just aren't aware of, and if they are aware of them, they're not sure how to access them, so those are some things that we can help with. If I knew then what I knew now, my transition home would have been much different. And so what we want to do is make sure that everybody is aware of the programs that are out there, not just what we're doing here internally, but all of our partnerships out there in the communities. You know, we all work together.
Right.
You know, this is a team effort for sure. You know, and so as we started exploring the data, we started finding more need. You know, so not only was suicide was one of the driving factors behind the program, but then we started exploring different things that kept popping up and that we were hearing about over and over again. Female veterans being one of them, right? So my view coming home was a soldier is a soldier is a soldier, and gender doesn't define the service, service defines the service, right? But the culture is shifting right now, where females are a growing population in the military community, but the community back home that has established a lot of the organizations hasn't made that cultural shift yet, you know, that mindset shift yet. So a lot of the females in the community go to their organizations, and I hate to use the word non-equal, you know, the term non-equal, but they're not treated equally through these because that culture is still shifting. We're creating the culture here now, so there's no culture to shift. We just make it as it is.
So you have a separate female program?
So we have a separate female program. Right?
Okay.
And what we found, and the reason why we did that is that we found that, you know, females 34 and under have an unemployment rate of 8%. You know, these aren't numbers I'm making up. These are numbers that come from the different government agencies. Their suicide rate between 2005 and 2015 has increased by over 62%. You know, there's a lot going on there. So
there's a lot of need.
There's a lot of need.
And this is a starting place.
And this is a starting place, right? So by establishing peer groups so people can share their information together, by introducing some limited financial aid, some acute financial aid for that need, so that one stumble won't begin a spiral. So we can help people stand back up, and we can work together to address these. We're doing some great things. We've already seen a tremendous impact. And we know that's just going to escalate more and more as time goes on. So we're really focused on prevention and not reaction.
We could do a whole show just on that, really.
Oh, it'd be a lot of fun, too. You'd love it.
Well, first of all, I want to thank you so much for your service. My dad was in the military, and my husband as well. And so thank you so much for your service.
Well, thanks for coming down and
wonderful
helping us
things
spread the
that you're
word.
doing. Yes. Yeah. So, and the same way to contact you regarding the program is through the website.
Yeah, so you can either go through the website, you can find us on Facebook if you do a search for Veterans Count Massachusetts. You can kind of see what we're up to and the different things that we're doing. And my contact information is all over the place. Feel free, just pick up the phone, give me a call, shoot me off an email, and I'd love to chat.
That's wonderful. Well, thank you so much for both of the work that you're doing. And Rob, tell us about, hi, how are you? Tell us about, first of all, who's this
This
wonderful?
is my service dog, Kilroy. We've got matched over, a year ago. He's from Needs, great organization in up on 140, going towards Mount Wachusett. So they're a fantastic organization. He's just basically, helps me day to day, and right now he's just kind of relaxes and hangs out.
He's beautiful.
Yeah, I'm a lucky guy to have him.
And I have a question. Are you allowed to touch service dogs, or what's?
The best thing to do is if you see someone with a service dog, just ask. If you're curious to say hi to the dog, ask the owner. If it's all right if they pat the dog. If they say no, then that's the answer.
That's the answer. Okay,
if you see a guide dog, it's definitely best just to not approach the owner and the dog at all. That dog's working very hard.
Okay.
And I think the same thing goes for most dogs that you see that are working dogs. It's best to ask, but if, for a guide dog for an individual that's visually impaired, that dog's working very hard and needs to concentrate a lot to keep their owner safe and guided. So it's best to not approach someone with a guide dog.
And it will say guide dog versus service dog?
Yep, their
Is that
vest
how
usually
you'll know
says
the
guide dog.
difference?
Sometimes individuals that use a guide dog will have a type of like halter on the dog almost, like a
Right.
stiff,
Yeah.
like a handle, whereas Kilroy, I'll usually have him connected to my chair. So that's, and again, there'll be a vest on the dog. Usually I'll say guide dog. So that's, you'll definitely know a service dog when you see one,
Okay,
for sure,
great.
even if they don't have their vest on, which they should.
Okay, great. Well, so tell me, I met you actually at a networking group. We came here and actually you showed us all the I was shocked at the technology available to help people with disabilities. So I wanted to come back and learn more.
Yeah, thank
and
you for
so,
doing this. This is great.
It's amazing. So tell us a little bit about what your role is in this assistive technology program.
Sure, yeah, so I started out here before we opened the center. I hired as the program coordinator for the Mass Match Technology Center here in Worcester. We currently have one in Boston that's been in operation for about 10 years. And there's another center out in Pittsfield operated by United Cerebral Palsy, Berkshire County. So there was a big service gap there between Boston and the New York border.
Mm-hmm.
So, Easterseals approached MRC, which is Mass Match is a program of the Mass Rehabilitation Commission. So we saw a need for a center in the central Mass area, and we came on, we converted the room and repainted it and put all the technology in here. And my job as a coordinator is just to track equipment that is loaned out to individuals that come in and access the program. So it might be individuals with disabilities, teachers, different service coordinators from other agencies. Like we have a lot of people from Elder Services in Worcester come in and borrow equipment for their clients to try out. So my job is just kind of to oversee equipment going in and out, also do public outreach, kind of make sure we're always on the cutting edge of technology. We always have like a wish list going where we keep track of what technology we'd like to have in the future. When funding comes in, we're able to get that equipment, or when we have a great donors that have helped us in the past. So
I was going to ask you, where does the funding for the equipment come from?
yeah, so I think Easterseals is very fortunate. A lot of our programs are linked in with federal funding or state funding. But we also have a great gifts department that works on fundraising and grants, things like that, and donors. So we're very fortunate. We've had very generous donors in the past, and the state and federal funding has been great to allow us to expand the programs that we have, both the Easterseals Technology Centers and Adam's new program. So we're really growing, and we've had great success with that.
And you said you can loan them.
Yes.
So tell us a little bit about the loan program.
So the loan program is a 30-day loan program where it's a free program open to the public. Anyone can come in and borrow a variety of devices for up to 30 days. And the great thing about that program is it allows an individual to access a lot of assistive technology that they wouldn't otherwise have access to be able to try it out before they acquire it through their insurance or through MRC if they're an MRC client, or if they're trying to purchase it out of pocket. So it's a great way for individuals to try out different equipment before they make a purchase or use whatever resource they have and find out the equipment doesn't work for them.
Is the equipment covered by insurance, or how do people pay for this equipment? Because
So-
I assume some are expensive.
We have people that are seeking different avenues to acquire this equipment. Easterseals, part of our assistive technology program is our financial loan program. So
Okay.
that's a great program that allows individuals to apply for a loan to purchase this equipment themselves if they're not going through insurance or if they're not a client of another program. Before I started working here at Easterseals, I applied for a loan to convert my van so I could drive it from my wheelchair. So the AT financial loan program covers equipment from $1,000 up to $20,000, $30,000 loans, and it's a great program because unfortunately, a lot of assistive technology is expensive, and no one has a few $1,000s just laying around like that.
Right.
So it really allows people to acquire equipment and pay for it on a monthly basis, a much more affordable way.
Okay. and you're going to go and show us some of the technology that you have here.
Absolutely, yeah.
And so we're going to be doing that in a couple of minutes. So that's wonderful. Well, thank you so much for that
problem.
information. And all of you, thank you so much. That was great information. And I'm hoping that the viewers will definitely go to the website. It's www.eastersealsma.org.
So the Assistive Technology Center here in Worcester and Boston and Pittsfield, it's a free program. It's open to the public. If you're interested in borrowing assistive technology or just learning more about assistive technology, please look us up on our website, Eastersealsma.org. So this is one of the new initiatives that we started here at the Worcester Assistive Technology Center, and also in Boston. There's a big movement nowadays with assistive technology to create assistive technology on your own, the whole do-it-yourself movement, makerspace. So this is we're just starting to scratch the surface here. We purchased a 3D printer back when we opened, so we're able to make some really low-tech, easy assistive technology. So one thing that we printed out here, this is a really cool pen or pencil holder. So for someone that might have a difficult time gripping a pencil, they could use this as a ring holder. And then now the pen or pencil, they're able to hold it much better. When we printed this out on the printer, it took about an hour to make. We adjusted the grip with some moldable glue that we have. And so we were able to make that in about a day. And what's really cool about this, we could have clients come in. They can, say, I'm having a bit of an issue with a piece of assistive technology I have, and we can further augment it for them. Out in Boston with their 3D printer, they were actually able to make and design a adapted switch, and we'll show you what these can do in a few minutes. But so it's really great. We're able to create our own assistive technology for a fraction of the cost, have something made in an afternoon, and we also here in Worcester partnered with the Mass Academy program, which is part of WPI, and we've had an intern coming in about once or twice a week, and he's currently working on an electronic device that will automatically water plants for an individual that might not be able to physically water plants. And it's going to connect to an application on a phone, so if someone is away from home, they could still monitor their plants and water them themselves. So this has been really fun and exciting. It's something that we're learning. I'm definitely learning a lot about the DIY movement as we go, and it's been just a really fun, creative project that we're starting to work on. So some of the equipment we have here is part of the Mass Match Weight and Seating Independence Program. We have several pieces of weight and seating equipment throughout the state. We have some devices here in Worcester, a few devices out at United Cerebral Palsy in Berkshire County, and also we have there are roll-on scales for individuals that use wheelchairs that might not be able to get out of their wheelchair. Those are located at Center for Living and Working here in Worcester, and also Stavros Independent Living Center in Springfield. So one of the devices that I want to show is this is what's called a pressure mapping system, and this is again a piece of equipment that anyone can come in and borrow to try out for themselves. And what this does is map someone's seating profile to show where they have pressure points, where they might be more apt to develop pressure sores. It also allows someone to try out different cushions and see what how that cushion might affect their seating and pressure points. So it's set up, and it comes with this laptop. We have it connected to the TV here, so you can kind of better view the program. So Sherry, maybe if you want to try it, I could just show off how it maps someone's pressure points.
Do I just sit straight?
Yeah, so you just sit like that. So actually your profile is great. So what you would want to see is you want to see blue and green. That really marks where there's very low pressure points. Where there would be high pressure points, maybe if you'd want to lean to one side, we might be able to demonstrate that. You can see how it gets darker, and that red would indicate a high pressure point. So if you were an individual with a spinal cord injury and you were to see something like that, you would know that you'd be more apt to develop a pressure sore in that red area. And you'd want to see if you'd need to try to adjust yourself to alleviate that. And what's great about this program is you can take it with you to a seating clinic to try out different items. Different seat cushions. You can also print out the images to show to your doctor or if you're going to a rehab hospital, and really have a better idea of what you can do to avoid pressure sores. and how to get, better seating for that. And that's great because, having a pressure ulcer, especially for someone with a spinal cord injury, they might not be able to realize it's there until it's really, really progressed, and that
Right.
can, even be deadly. So it's a really great preventative tool that we have here. So this area of the Assistive Technology Center is where we keep a lot of our adapted computer equipment. So Easterseals works with individuals with varying disabilities. Like Ali had mentioned earlier, a lot of these students or individuals are our students that are going off to school, or individuals that are with disabilities that are looking to gain employment. Obviously, computer equipment is really essential to that nowadays. So we have a lot of different adapted computer equipment. For example, this right here is called a jaw mouse, or a JOUS for short. And this is a mouse that can plug into any computer and allows the user to operate the computer using just their mouth. So it operates on a sip and puff switch, this thing right here. And basically this is a joystick, so and an individual would use their mouth to move the joystick, and through puffing on this or sipping on it like a straw, perform different functions like clicking, double clicking, or dragging. You can also, with the box here, plug in a variety of other switches as well. And what's great about this is a device that someone can borrow with one of our Chromebooks here, with one of the laptops, and try it out at home or at school or on the job. In regards to vocational items, this can be really great, because if an individual with a disability is offered a job but they don't have the equipment yet, or the employer hasn't provided that accommodation yet, they can borrow equipment from us and be ready to work within a few days when they get the equipment. So that allows someone with a disability to really be competitive when they're looking for employment. So, but again, students can borrow this equipment. We have a variety of tablets that a student can borrow, these Chromebooks, laptops, and someone can really borrow it with just as is, a computer as is, or with a variety of adapted computer equipment. Another really innovative adapted mouse that we have is this PCI Plus. That's this bar here on the computer. And again, this device in the program can be uploaded to any computer. And what it does is it's an eye track mouse. So this, for someone who might not have full use of their upper body or hands to navigate a mouse in a traditional way, they can just use their eyes. So it might be hard to see, but I can definitely demo. So right now, I'm looking at the pause and start button, and it's tracking my eye movement. There's this bar here on the side. So it might not look like I'm doing anything, but I'm tracking it with my eyes, which is it's a really innovative piece of technology. So this section here is where we have a lot of our communication devices, our augmentative communication devices. A lot of times we'll have different groups come in to borrow these devices. Mostly school systems will come in, or teachers will borrow them, or our speech language pathologists will go out with these. This is very helpful for young adults or children that are nonverbal, or someone from the elderly community that might have had a stroke and is nonverbal or developed aphasia. What's great about these devices is it allows, and what's great about our program is an individual can come borrow, let's say, a tablet with a variety of speech devices, or borrow a standalone speech tablet like this Indie device here that has a few speech programs on it. And again, what's great about the Assistive Technology program is that a lot of this equipment is expensive, and it's definitely challenging for an individual to afford to purchase these on their own, and a lot of times it's very hard to get a trial version of some of these devices. And especially with a lot of programs that have had funding cut to them due to federal funding cuts recently in this past fiscal year, it's even harder sometimes to acquire these devices through other state and federally funded programs. So Easterseals allows an individual to come in, borrow these devices, see what works best for them, see which devices they prefer, and then make a more informed decision when it comes to purchasing it or acquiring these devices through other funding sources from the state or federal government.
So Rob, I just want to thank you so
No problem.
much.
Thank you for coming. Really appreciate it.
This has been incredible, and I know there's so much more equipment that you could show us. Unfortunately, we don't have that much time today left, but I want the viewers to remember that they can go to www.eastersealsma.org and they can get all your contact information.
Yep.
And they can actually come down here and see all the equipment that meets their needs. So please, viewers, if you yourself or know somebody who could take advantage of this, please do so. Thank you again very
No problem.
much.
Thank you for coming.
So next month, tune in again as we will have the 1540 connection on the show. But I want to again thank the guests. Thank you, Rob. Thank you, Allie. And thank you, Adam. And it's been great to be on location with you today and learning all about Easterseals and your programs. So this is Sherry Keating. Until next time, remember to live your best life every day starting today.